Hello and welcome to this video about how to treat yourself from whiplash, from post-concussion and from fibromyalgia. So in this video we're going to talk about how to treat the neck and get rid of all the sore spots and all the trigger points in the neck area. So when it comes to neck massage and any other trigger point massage for the trapezius and for the sternocleidomastoid, we apply a no tolerance policy towards sore spots and towards trigger points. That means that anything that radiates out, anything that hurts just a little bit, any sore spots, any hard muscles or any tension at all needs to be massaged away. So that means we're not focusing on one particular muscle, but a selection of muscles, and we are simply going for everything that hurts. So a quick note about the symptoms that trigger point and tense muscles in the neck area can give you. First of all, you will have a lot of headaches. So you can experience headaches in the back of the head here, and also on the top of the head and on the side of the head. You can have some pain in the neck itself. And you can also have this sensation of living in jelly. And this is a sensation that is only really understood by people who suffer this. So the sensation is that nothing really exists without, or your reality only exists within 1 meter around you. So it can feel like living in a dream, and you are not really receptive towards impressions, that being visual or sound impressions or social impressions, if it's too far away. Then you can experience a lot of tiredness or just not being up for your activities. You can also experience watery eyes, so that would probably come mostly from the upper part of trapezius. And you can experience jaw pain also from the upper part of trapezius. Alright, so how do you actually treat the neck area? Well, once again, you need to get your hands on a back knobber. It's absolutely impossible to complete any kind of serious massage program without this one. So it has a small arch and a big arch, and I always recommend that you use the big arch. So the objective is straightforward. You need to massage anywhere in the neck area which hurts, which radiates out, which is tense just a little bit. You need to be able to apply a lot of pressure without it hurting at all. So the way to go about this is to take your back knobber and then put it up in the neck area. And when you find a spot, a trigger point, which is a little sore, it's the best way to find it is to choose that place in your neck which is the most sore, which radiates the most out. It doesn't have to radiate out, but it's a good trigger point if it does. It's a trigger point in need of treatment if it does radiate out. And also pay attention to small lumps or small increases or hardness in the muscle. So you find the trigger point and you apply a pressure on a scale of pain from 0 to 10. It needs to be around 5 to 7. But be careful when you're just starting out, because many people apply too much pressure when they're starting out because they think once they've found it, it really needs to be massaged away. But you cannot do like that with trigger points. You need to be patient and you need to apply the correct amount of pressure. So it's a pressure from 0 to 10. You need to go about 5 or 7. And then you need to apply a pressure for 45 seconds. It could be half a minute, it could also be 1 minute, but the good rule of thumb to start out with is 45 seconds. So when we massage the neck, we divide it into 4 different lanes. And the first one goes from behind the ear, so here, and down to the side of the neck. This lane, so you would take the back knobber and put it right behind the sternocleidomastoid, like this, on this spot. And then you would move, or you will move downwards like this, all the way to the side of the neck. On the base down here. The next lane is in the back of your neck. So it's very, very close to your spine. So the way to find it is to use the back knobber and first find the spine. So the spine is in the center of your neck. So you would have to find that, and it's some rather hard bones. And then you just move slightly to the side. It should be about this much, maybe 5 millimeters, maybe 1 centimeter. You move to the side, and that's where you find the first row of muscle. So you would take this line downwards from the top of your skull, or the base of your skull, and all the way down the neck like this, all the way down. So you start up here, you find your first trigger point, and you hold it for 45 seconds. And then when you've treated that one, you move it slightly down like this. And then you hold it for 45 seconds and you continue like that. The same goes with the line on the side. So those were the 2 first lines, the one on the side and the one all the way back on the back of your neck. The 2 next lines are 2 lines that lie between the 2 first ones. So the first one here, the second one very close to your spine, and then you have 2 more lines going down here. So keep in mind these lines are imagined lines, and the reason we want to divide it up into these lines is because we want to make sure that you cover the entire area of the neck when you massage it. So you follow these lines, and basically you catch, or you apply the pressure, or you treat every single trigger point that you find. You don't necessarily have to move along these lines. If you find it more easy just to put up the back knobber and apply the pressure wherever you want to, it's okay. But an advantage with these lines is that you tend to grow into a massage pattern. So many people will grow into a massage pattern, so they will treat this, and this, and they will never really get any places else. So if you apply this logic with the lines, then you are sure to cover most of the neck. So massaging the neck comes with 5 different ways of using, or basic ways of using the back knobber. The first one is maybe the most obvious one, where you hold the back knobber like this, and you can apply a pressure both going outwards if you are in the back of the neck, or going slightly that way if you have moved to the side of the neck here. Another way to use the back knobber is to put it on your chest like this. The knob here will go into the back of your neck, and you extend your arm through the small one, and then you let it go downwards like this. So that's the second one to use, the second method of using the back knobber. The third way to use the back knobber is where you put the back knobber under your arm, and you can both pull downwards with your arm like this. This is not ideal for all people. Some people like it, some people do not like it. But the idea is that if I let go of my shoulder here, it will generate a pressure up here. The fourth way of using it is somewhat similar. You also put it under your arm, but the power doesn't come from you lowering your shoulder. The power comes from you applying pressure here. So when you apply pressure here, the back knobber does like this, which goes into your neck. So these two versions where you put the back knobber under your arm are especially good on the side of the neck. And then you have the fifth one where you use the back knobber, and it looks like this. So you support it with your hand here. This one is especially good for the upper parts of treating the neck, and in particular this very sore spot, or for most people this is a very sore spot, the upper trapezius and the upper levator scapula, and you support it with your hand like this, and then you push downwards with this hand over here. So the back knob will do like this. And then finally you have two grips where you're using your hand. So one is, it resembles very much the ones that we are using for sternocleidomastoid. And one is where you use, it's called a supported thumb, like this. Or straight thumb pressure, you do like this. And basically your thumb presses in to the side of your neck. This obviously only works on the side of the neck and doesn't work on the back. And then you can also use a half-closed fist to apply some pressure. Thank you for watching this video. If you found it useful, please share it with other people who need it. For daily video updates, please like my page on Facebook, Curalistic.com, or visit my website www.curalistic.com. If you've got any questions, please add me on Facebook, Gustav Grundsø. Thank you.